Integrating Faith, Enhancing Rational Emotive Behavior Therapy for Holistic Mental Wellness. This video explores the potential integration of religious content and practices into Rational Emotive Behavior Therapy, REBT, to support individuals of faith in overcoming mental and emotional issues associated with life's daily challenges. REBT, an internationally acclaimed psychotherapeutic approach, primarily focuses on helping individuals move beyond unhelpful beliefs, emotions, and behaviors that tend to impede individuals in attaining daily life goals. However, for individuals deeply rooted in religious beliefs and practices, incorporating faith-based elements may provide a more comprehensive framework for addressing their emotional and psychological challenges. This video briefly discusses the theoretical foundations, practical applications, and ethical considerations of integrating religious elements into REBT, shedding light on the promising synergy between spirituality and mental health. Rational Emotive Behavior Therapy has long been recognized as an effective approach for addressing various mental and emotional issues. Developed by Albert Ellis in the 1950s, REBT focuses largely, but not exclusively, on the identification and alteration of unhelpful beliefs, often called irrational beliefs, and interpretations of perceptions that contribute to emotional distress and behavioral dysfunction. While REBT is a secular psychotherapy model, the diversity of human belief systems necessitates an exploration of how religious content and practices can be integrated into REBT to cater to individuals of faith seeking mental and emotional support. It is true that early in the history of the development of REBT, Albert Ellis viewed religion as irrational and a form of psychopathology. However, in his interactions with REBT practitioners who were Jewish, Christian, Muslim, and people of other faiths, he came to realize that it is fully possible to integrate the authentic faith of individuals with the REBT model. Books on the integration of the two have been published and workshops offered on the topic. This video aims to examine the possibilities of incorporating religious elements into REBT to create a more holistic approach for addressing mental and emotional challenges within the context of faith. It delves into the theoretical underpinnings, practical applications, and ethical considerations of blending REBT with religious faith to foster emotional resilience and overall well-being while attempting to be true to the REBT model and relevant aspects of religious faith and practices. REBT acknowledges that individuals' beliefs significantly impact their emotional and psychological responses to life events. By recognizing the importance of belief systems, therapists can appreciate the profound influence of faith on mental health. Many faith traditions offer coping mechanisms, such as prayer, meditation, and scripture study, that can be integrated into the REBT process to help individuals manage their emotional responses more effectively. Integrating faith into REBT involves helping individuals align their rational thinking with their religious beliefs, ensuring that their faith serves as a source of strength and emotional stability rather than contributing to cognitive distortions or behavioral dysfunction. Scripture-aligned rationality may encourage clients to identify and challenge unhelpful beliefs by drawing on religious texts and teachings that promote rational thinking, forgiveness of self and others, as well as resilience. Prayer and meditation in their various forms may also be incorporated into the therapeutic process if desired by and relevant to the client. Research has indicated that this integration may prove helpful for clients of faith find inner calm, reduce anxiety, and develop emotional resilience. For example, research conducted at Columbia International University demonstrated that the use of an REBT-structured prayer reduced mild to moderate anxiety better than psychoeducation alone. Faith-based affirmations that align with REBT principles can empower individuals to reframe or replace their dysfunctional thoughts and beliefs, fostering emotional well-being. For example, when scripture is used specifically as a dispute of a client's irrational belief causing emotional or behavioral dysfunction, it may help the client reduce the dysfunction. This is in alignment with REBT cognitive intervention of identifying, challenging or disputing, and replacing dysfunctional beliefs with functional beliefs. It is vital that prior to integrating faith and REBT that thoroughly address relevant ethical considerations and cultural sensitivity. In no way should a therapist ever try to convince a client to such an integration. To do so would be an unethical use of a therapist's power in the client-therapist relationship. Therapists, to be ethical, must approach faith integration with sensitivity and respect for the client's specific religious beliefs, ensuring that the integration process aligns with their values and practices. This necessitates initial discussions of the pros and cons of such an integration. The client must endorse this integration, and there must be ongoing open discussion about the use of the integration. Clients should be fully informed about the integration of religious content and practices into therapy, allowing them to make informed decisions about their treatment. Without such informed consent, no integration should be initiated in any form. In cases where faith-based integration may not be appropriate or desired, therapists should be prepared to offer alternative treatments or referrals to ensure the best possible care for the client. The therapist must not assume that the therapist knows best what the client needs and proceed without full and complete informed consent. Integrating religious content and practices into REBT, or any other psychotherapy model, may be a powerful way to support individuals of faith in their journey toward improved mental and emotional well-being. By recognizing the importance of belief systems, leveraging coping mechanisms from faith traditions, and aligning rational thinking with religious beliefs, therapists can offer a more comprehensive approach to addressing life's daily challenges. Through practical applications such as scripture-based rationality, prayer and meditation techniques, and faith-based affirmations, individuals can find a deeper sense of meaning and resilience in their faith. However, it is essential to approach faith integration with cultural sensitivity and ethical considerations to ensure that therapy remains client-centered and respectful of diverse belief systems. The synergy between faith and REBT opens new possibilities for more holistic healing, emphasizing that emotional wellness is not only about cognitive restructuring but also about nurturing the individual in all their aspects. It is a testament to the evolving landscape of mental health therapy, where inclusivity and customization are key to promoting mental and emotional well-being for all. By embracing this approach, therapists and individuals alike may better embark on a journey of healing that honors the profound connections among all aspects of the individual. For more information, email Dr. Steve A. Johnson at steve.johnson@ciu.edu.